It's time for another new Kansas City Spotlight. Here's your host, Lauren Scott.
Here in the Kansas City area, there are thousands of cases of epilepsy diagnosed each year, and the staff of the University of Kansas Health System is working tirelessly to diagnose and cure as many as possible. I'm Lauren Scott, your host for Kansas City Spotlight, and today I am joined by neurosurgeon Jennifer Cheng with more. Hi, Jennifer. How you doing?
Hi, I'm good. Thank you.
So what is epilepsy?
It's a disease where people have seizures. A seizure is abnormal electrical activity that comes from the brain.
How exactly is epilepsy diagnosed?
One has to take a really good history to understand what the patient experiences when they're having a seizure. And then there can be further testing, such as doing an EEG, which will show us the brain activity that occurs when the patient is having a seizure.
Now, how many people in our region have epilepsy?
Of the 5.6 million people in Kansas and Western Missouri, about 2,800 people per year are newly diagnosed with epilepsy. And of those people, 40% will be drug resistant. So that's 1,100 people. And what that means is that despite taking medications, the seizures are not well controlled.
So what is done when medicines do not work? Can seizures be stopped with surgery?
It is possible to use surgery to stop seizures. We have to do a very fine, comprehensive workup, and we try to look for where the seizures are coming from within the brain. So that includes doing a lot of different tests, such as MRI, other imaging tests. We do EEGs. Sometimes we even implant electrodes into the people's brain and use that to localize where the seizures are coming from. Once we know where they're coming from, we can do surgeries to treat the epilepsy.
So tell us about your multidisciplinary team. Why is it so important that you have these specialists all working together to decide the best treatments?
People who have epilepsy, they can often suffer from depression and anxiety. They usually are not able to drive. They may not be able to hold down a regular job. They may have memory issues as well. So, it's really important to take into context their social and psychosocial life in order to treat them. We have to look at the patient holistically, and that's what we try to do with our team.
How many surgeries per year does your team do?
For the last 3 years, we've done over 100 surgeries for epilepsy every year. And that puts us within the top 5 in the nation in terms of our volumes.
What do you want our local community to know?
There can be more than just living with the seizures the way they are now and just taking medications your whole life. You could seek another opinion. You could come to KU. We will bring our comprehensive team and do an evaluation for you. And we really want to help our patients find answers.
Thank you so much.
This Kansas City Spotlight is sponsored by the University of Kansas Health System.